we wish to inform you that the purpose of the research is to evaluate whether the Family Bereavement Program is engaging, useful, and a viable community resource for parentally bereaved families when offered in a bereavement support center like the Dougy Center. Now, if you decide to participate, please understand that your involvement in the Family Bereavement Program is voluntary, and it involves several aspects, each of which I'm going to outline next. First of all, participation consists of 12 group sessions with about 6 to 10 other caregivers experiencing the death of a spouse or caregiver and 2 trained group leaders, plus 1 individual session that is also led by one of the group leaders. You should understand that the time commitment for these sessions is approximately 25 hours. Also, that the purpose of these meetings is to provide you with information and skills to assist in understanding and helping your child or children to cope with the death of a parent. Secondly, for those children of yours who provide assent, that is, who agree to participate in groups, they will also participate in a program consisting of 12 group sessions with about 6 to 10 other children or adolescents, depending on their age. All of these children will also have experienced the death of a parent or caregiver. The group will again be run by 2 trained group leaders. There will be 1 individual session led by one of the group leaders. Again, please understand that the time commitment for these sessions is about 25 hours, and that the purpose of these meetings with your children is to provide your children with the coping skills to assist in their dealing with the death of their parent or caregiver. Now, third, before the intervention actually begins, you will be asked to complete questions about your family and about yours and your children's feelings and problems. Please understand that you do not have to answer any questions that make you feel uncomfortable. Your responses to the packet of questions will be reviewed, and based on your responses, you will be either invited to participate in the program or encouraged to receive services that might better meet the needs of your family. Prior to, during, and immediately following the program, you will also be asked additional questions about your expectations about the program and to provide us feedback about the program. Following the completion of the program, you will again be asked questions about your family and yours and your children's feelings and problems in order to help evaluate how helpful the program was to you and your family. We estimate the time commitments for these assessments are approximately 45 minutes for each of the assessments, that is, those that occur prior to the start of the group and at the end of the group, and approximately about 10 minutes during the course of the program. Prior to the intervention beginning, with your children, ages 8 to 16, that have provided assent and agreed to participate in the group, they will also be asked questions about your family and their feelings and problems. You should understand that your children will be informed that they also do not have to answer any questions that make them feel uncomfortable. Their responses to the packet of questions will also be reviewed. Your children will be asked about their expectations about the program and to also provide us feedback about the program after it is completed. Following the completion of the group or the program, they will again be asked questions about their feelings and problems in order to help us evaluate the program, how helpful the program was to them. Again, we estimate that the time commitments for these assessments to be approximately 45 minutes, and then that those assessments will again occur prior to the start of the group and at the end of the group. Finally, as the last clarification about your participation in this research, is that you should understand the sessions that you and your children attend will be videotaped so that the leaders can show parts of the sessions to the supervisor, who is a licensed clinical psychologist, and who provides suggestions to the group leaders to make the program activities more effective for the families in the groups. These videotapes will be used for really monitoring the quality of the services and for training future group leaders. Please also understand that the group being videotaped is a requirement of participating in the Family Bereavement Program. If you choose not to be in a group that is videotaped, you can still participate in the regular support group offered by the Dougy Center. In signing this document that you have been given, you'll be providing your permission to be videotaped and your children to be videotaped and to allow the use of these videotapes as I've described earlier. You should also know that these videotapes will be destroyed at the conclusion of the study, but no later than June 30th, 2012. Now, with any research project, there are some risks, and you should understand that the only foreseeable risk of negative effects for you and your children from participating in this study is the psychological discomforts that may come from talking about stressful experiences. You should also know that the group leaders and their supervisors will be available to talk with you and your children if these kinds of discomforts arise. As with any research, there is some possibility that you may be subject to risks that have not yet been identified. However, there are no feasible alternative ways to accomplish the objectives of this particular study. Also, we hope that you know that there are potential benefits to you. First of all, you should understand that the possible benefit to society in your participation is that the researchers will learn how to most effectively implement this program for caregivers and children in agencies such as the Dougy Center. You should also understand that the opportunities for you and your children to discuss your feelings and ways of coping provided by the program may also help you and your children feel better. Now, if we as researchers find new information during the study that would reasonably change your decision about participating, then we will provide this information to you. As with any research project, confidentiality is also key. And all information obtained in this study is strictly confidential unless disclosure is required by law. Now, the results of this research study may be used in reports and presentations and publications, but we as researchers will not identify you personally. In order to maintain the confidentiality of your records, myself and Dr. Sandler and Wolchek will use the following procedures. All of the data collected by the Dougy Center will be handled with respect to your confidentiality. All data that is transferred to ASU will be labeled with numerical codes, and your name or your children's name will not be attached to this information. Again, the key to the numeric code will be kept at the Dougy Center, and only members of the Dougy Center, not ASU staff, will have access to it. Your records at the Dougy Center, of course, will be maintained according to HIPAA and university standards. The keys to these numerical codes will be maintained at the Dougy Center during the course of the group, and they will be destroyed at the end of the program. In reporting the results of this research study, you will never be identified by name, and indeed the use of full names will be discouraged during the course of the groups, and as a practice only first names will be used. If by chance a full name is used, they will be deleted before the videotape is shown for research or educational purposes. You should also understand that the staff at ASU and the Dougy Center are required by law to report to appropriate authorities physical injury to any child caused by other than accidental means. We also want you to know that should any information you provide which suggests a serious need for psychological assessment services, as in the case of kind of extreme behavioral problems or potential suicide, that the staff at ASU and the Dougy Center will confer, and the Dougy Center protocol for referring families out for more appropriate services will be followed. Now, this might include an immediate assessment of risk to help determine what services may be most helpful to you and your family. As in any research project, you have the rights to withdraw your participation. And I want you to understand that it is okay for you and your children to say no to participating in this study. Even if you say yes now by signing the consent form, you are free to say no at a later time, and you should understand that you can withdraw from the study at any time. You should also understand, if you agree to participate in the study, that your consent does not waive any of your legal rights. However, no funds have been set aside to compensate you in the event of injury. Now, except for the circumstances mentioned above, or earlier, all the information gathered and the research study records will be kept confidential unless you authorize their release or the records are required by law. You should also know that the research in which you will be participating does not involve more than minimal risk.